It's time for my nursing tip of the week, and in this week's tip, we are talking about some follow-up questions that I like to ask doctors before they leave the room. If you've been a nurse for more than 2 seconds, you know that a provider's time is very limited. They are spread very thin, and so usually when they are assessing their patients, they are in the room doing that assessment, talking to the family, patient, nurse, whatever, and then they're out. And once they're gone, you think of a million questions of things that you should have asked for, and then you're trying to get a hold of them, and it's this whole process. So these are some follow-up questions that I pretty standardly, is that even a word, ask providers whenever they are doing these things. So for example, after a patient receives a blood transfusion of any type, I will ask, hey, do you want any follow-up labs? If a provider is ordering a CT of a patient's head or abdomen or whatever it is, I will ask, hey, are there any additional tests that you are considering that this patient may need? Nobody likes to go to CT twice in the same shift. So if I'm already there for one CT and you're also wanting another CT, let's do them all. Whenever a provider orders sedation on my patient, I always ask them, what is your RAS goal? I need to know, how sedated do you want this patient to be? Sometimes you and I may have different ideas of how sedated this patient needs to be, and I don't want to assume. Whenever a provider rounds on a patient and there's no family there, and if I'm anticipating family coming in or maybe calling, I'll always ask, hey, if family comes in, do you want me to call you back? Those are just a handful of questions that I usually follow up with for providers. They help me save a little time, help me be more efficient of a nurse. So let me know if there are any other questions or things that you standardly or routinely ask on patients.